You know, the phrase "see me as a person" that we used for our book came from a patient that was in one of the classes that brought me to creative healthcare management, is a class called Reigniting the Spirit of Caring. I developed it when I was within an organization. And it's 3 days with healthcare workers, where in the curriculum is caring for self, caring for team, and caring for patients and families. But the frame around 3 days is to give people space to really connect with their own humanity and the humanity of others, because it's a counter to healthcare just being constantly push, 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 push. So when we create that kind of space, some really magical things have happened for the teams, for the individuals. And part of it is patients come in and work with us on the second day to share their experiences. And this was a woman who had breast cancer and had been battling it for about 5 years. We asked her what mattered most to her in her care. She said, "I want to be seen as a person." And I said, "How does that look for you to be seen as a person?" And she said, "I know I'm just not a statistic. I know I'm just not a task for the day. I know I'm somebody that is human to the people that are touching and caring for me. And when that happens," she said, "I feel safe, and I know I'm more able to heal than when I'm stressed because they may not see me." So being seen, being heard, having the kind of respect and care that allows me to heal is more than a nice to have, isn't it? It's core and essential for healing. So I think that's why the work is so important. And that healthcare workers are not afraid to care. And I'm just going to say quickly why I'm saying that. I think for a long time, it was seen that compassion, or too much compassion, really would wear you down and burn you out. And what research has shown, and I think Lola, you referenced research as well, that when you care and when you see the effects of your care, it's rejuvenating. It is not diminishing. And that's not meaning the effects of the care means healing or curing. It's this, that it has created connection. And when you see that, feel that, know that, that is reinforcing to you as a care provider. So is not the pathway to burnout. The pathway to burnout is not feeling like you matter.
Have stories like that.
You have to have an environment though, and you have to, the first care is about yourself. You have to be so aware and have permission. Like, for example, the surgeon that came back, it's good that she had the courage, or maybe she talked to somebody, regained that balance, tuned in, because when you feel so much pressure about
Yes.
performing or knowing it all, you get very isolated with your own feelings. So I think creating an environment and encouraging people to reach out for each other and to share what's happening for them, it only provides an avenue to not suppress your emotions, which can be very toxic, very draining, very exhausting, but to have an environment where you share what's going on with you,
Right.
not feel weak or pathetic or somehow judgmental by other people. It has to have that type of environment where people do feel safe to do that.
That's absolutely right. It's absolutely right. When you talked about imagining the surgeon went out and talked to somebody, I love that you elevated that, because that's a very practical way to gain support when you run into complex relational issues, which happens all the time in healthcare. And just soldiering on and suppressing it is harmful to the self, and it's harmful to future patients. Creating a culture in which asking for help and support, and just hear me, let me talk to you about what just happened here. That went so wrong. What do you think? Can even just in the moment alleviate the pressure. What
The other people need to learn how to hold that, so not just jump into like solutions or do something, just basically understanding how difficult it can be for the person.
Right.
We are so